We speak now to Dr. Mtandeki Xamlashe, the Deputy Director General in the Eastern Cape Department of Health Clinical Services. A very good evening to you, and thank you so much for speaking to us. Perhaps let me start with asking this question: what's new and innovative about this particular hospital that you can say to the community justifies this investment of 689 million rands?
Thank you very much. Thank you for having me, Tepiso. This hospital is part of a major infrastructure revitalization of hospitals in Eastern Cape, with a special focus on rural communities, which we know historically have never had access to decent health care, that actually protects their dignity. So with the ushering in of universal access to care, funded by an NHI, which is envisaged to be rolled out soon in South Africa, this innovation or this state-of-the-art hospital will come as a major boost to our endeavors to improve access to care in the Eastern Cape.
I believe that the facility...
It is a very special hospital.
Yes, you can continue.
Yes, so you're asking what makes it different. The hospitals that we are now commissioning in the Eastern Cape are highly digitally enabled. You may realize that they are not so big in size. They are designed for efficiency and maximum connectivity across the province and supported by specialists in remote areas, because the broadband rollout in Eastern Cape is at an advanced stage. It is reaching most of our facilities by now. So it's going to function very differently from the hospitals that we built 50 years ago. It is a highly specialized in terms of infrastructure, and the standards of infection prevention and control in South Africa have changed tremendously, as you understand that the Office of Health Standards Compliance is well developed and guiding these kinds of new hospitals that are developed, so that there is no infection that can spread among patients that get to our facilities. It is a very special hospital to us in that regard.
And I'm wondering, how many districts will you be serving? I recall that last year the Eastern Cape lamented the high incidence of TB in the province and actually flagging 4 of these districts. And I'm wondering if you will be serving this when you talk about referrals, particularly OR Tambo, the Sarki-Bartman region, Nelson Mandela Bay, and Buffalo City.
Yeah, the hospital is located in Jokabi, close to the boundary with KZN province, and it is draining a lot of patients from Jokabi district itself and parts of OR Tambo. As you know that we are not a federal state, clients or patients from KZN province will have access to that facilities, especially for TB treatment, But as my Honorable MEC has indicated earlier on, that hospital is in close proximity to Taylor Bequest District Hospital, which is a very old facility. And therefore, this facility is likely to be repurposed so that part of it responds, to the needs of those communities, which are not necessarily TB. TB is still a problem in South Africa, but what is advanced is the treatment that is being given to TB patients. So there's no longer a need to keep our TB patients in hospital for a long time. Hence the numbers that are lower in our TB facilities in the country. The TB is still a problem. It is still a killer number 1 in the country, and therefore we are still serious about treating TB. The fact that the numbers in hospitals are lower doesn't mean that tuberculosis in South Africa has been defeated. It is still there, but the need for hospitalization has declined dramatically because of the advances in the treatment that is given to our TB patients.
And I want to talk about the advances and some of the resources that you'll have at your disposal. South Africa is one of the highest TB burden countries, and in particular, you say, for instance, facilities that provide decentralized drug resistant TB services are in Alfred Nzo, but as a country we're dealing with not only TB, HIV and MDR-TB. So what will be the specialization of this particular hospital? And if you can just tell us some of the innovations that you'll be using for screening or treatment.
Yeah, that hospital is equipped with advanced diagnostic treatment. As we know that we no longer depend on just taking sputums and waiting for months on end to get results for monitoring for both diagnosis of tuberculosis and also monitoring the effect of treatment. Now we have equipment and technologies like the Gene Expect that do the gene typing of the bacterium and to be able to detect even the small amounts of the TB germ in our body fluids using what is called Gene Expert. So those machines are available in that facilities. They can diagnose quickly and they can also monitor, the movement and absence of infectious stage from any particular patient, where it would be easier for patients to be sent back to home and to continue with and complete their treatment in the comfort of their own and under the support of their own families. So that hospital has got that. It's got digital X-ray because sometimes we need to do chest X-rays and consult experts like radiologists and physicians in remote hospitals. So those machines, those X-rays, they have that capability. And together with the connectivity that I talked about, the broadband connectivity in Eastern Cape, we're able to connect those X-ray machines and have a radiologist or a physician that is sitting in a specialist hospital like Nelson Mandela Central Hospital or Tata Regional Hospital, or even as far as Livingston Tertiary Hospital, to report on those images that are taken in those facilities without having to move patients up and down. Of course, in future, with the new units that are going to be added, as Honorable MEC mentioned earlier on, there may still be theaters that are available there, which may conduct certain procedures like partial lung dissections, which is very common in patients with drug-resistant TB. But those are for future. But for now, we are fit and ready and well-purposed to treat MTR and XTR effectively in that facility as it stands.
I'm just wondering, the figures, the data that you have before you now, obviously when you were building the hospital, you would have this in mind, a spatial analysis of either NTB mutations. What are you seeing? What are you hoping to do in future that would distinguish you, not only in your area, but nationally, so that you also grow yourself to be the go-to hospital for TB treatment?
The best way to deal with any condition, especially TB, is to prevent it. And unfortunately, we are battling with that in our country and perhaps in the continent, because TB is associated a lot with levels of poverty and obviously HIV infection in the current environment. So there are a lot of things that are being done. We're partnering with the universities, Walter Sisulu University, in terms of researches that can be done in order to improve the clinical outcomes around our patients there. And again, over and above that, we are part of a national effort as Eastern Cape, to try and do all we can to prevent the TB, to reduce infections with HIV, which result in increased number of TB cases that we have in the province. So certainly, with the future in hand and the technology right at our hands and at our disposal, even in remote areas, there will certainly be a lot that we do with the Walter Sisulu University Research Unit, and we work with Medical Research Council, and we've been working with them for years, which is why now we're able to have, treatment innovations that reduce hospitalization of TB patients. That facility does not belong to Eastern Cape, it belongs to the people of South Africa. And as you may be aware that Eastern Cape is one of the biggest labor sending areas to the mines. The conditions around the chest infections are not just limited to TB, There are other conditions that are a result of prolonged exposure to mine dust and other elements that are dangerous to your chest and that people are exposed to when they are working in the mines. So that area is got a lot of those kinds of clients. So we'll be on the alert, screening ex-mine workers for silicosis and for mesotheliomas and all other kinds of conditions that are a result of
Right.
exposure to mine dust and chemicals that are used in the mine. So there's a lot of work that's going to be done there. TB is probably your traditional label that is given to these hospitals, but they do a lot more than just looking at TB only.
All right, Dr. Xamlashe, let's leave it there with you. But thank you so much for your time. Dr. Mtandeki Xamlashe is the Deputy Director General in the Eastern Cape's Health Department, Clinical Services.